Welcome back. It's a Tuesday morning on your feel-good breakfast show. Always so good to have your company. Thank you for choosing us to start the day off with as we engage in some Medical Tuesday chat. Now, hair loss is what we're all about this morning. Now, studies have shown that you lose from between 70 and 100 hairs every single day from your scalp. And apparently, women actually lose particularly more hair in summer than in winter.
So stress.
Yeah, exactly. Oh, the stress that men bring along. Now, at least 90% of your scalp hairs grow while only 10% are resting at any one time. So it's quite a busy head that we've got going on.
It is, and we do know that hair loss is a great source of distress for many of us, and it'll leave you very self-conscious about your appearance. So here to unpack the situation and hopefully give us some more information on it, we've got trusted dermatologist Dr. Vanessa Lapiner in studio this morning, and then we've got our trusted doctor in the house, Dr. Darren Green. Always so good to have you on the couch. Good morning, Vanessa.
Both of whom have great hair. Just to mark that. I just want to mark that. Beautiful stuff. So let's first start by talking about the causes of hair loss.
Well, I think understanding that the hair growth as such is dependent on two main things, the seed and the soil. So the primary hair seed, which is the stem cell that is destined to become a hair, is there, and then the soil around it that causes it to rejuvenate and to move and to grow is actually dependent on nerve supply, blood supply, etc. So causes, the things that can affect both those systems are at play here, and the most important ones that we'd recognize would be genetics in terms of males and females, but also understanding then the effect of hormones on that. So menopause, certainly, the endocrine causes like the thyroid, hypothyroidism, and then of course secondary to other medical treatments as well as a side effect of certain drugs and obviously chemotherapy, as you know, and then stress itself also adding to the flavor. So quite a host of course.
Wow. Yeah.
Sure, Vanessa, what are the most common types of hair loss?
So when I see a hair loss patient for the first time, the most important distinction that I have to make is whether the hair loss is a scarring form of hair loss or whether it's non-scarring. So obviously the non-scarring types are the ones that you were chatting about that are more common. But if you have a scarring form of hair loss, the hair follicle has been irreversibly damaged. So you can, try and treat till you're blue in the face, but you cannot make the hair regrow in those patients. And the treatment then has to focus on stopping the process so that you don't lose more hair. Whereas with the non-scarring forms, you obviously can look at the cause, treat it, and stimulate the hair to regrow quicker.
All right, we're going to have our lines open on 021-430-9881. Give us a call. Our topic of the day in terms of our Medical Tuesday conversation is all about hair loss. And we've got the experts here, Vanessa Lapiner, dermatologist, and of course, Dr. Darren Green. Give us your questions. We'd love to engage with you.
It's my feel-good breakfast show.
And we're back again on the couch. As you can hear, the conversation's still underway, and we're hoping that you'll be engaging with us. Give us a call on 021-430-9881. Dr. Vanessa Lapiner as well as Dr. Darren Green are here to talk about hair loss. And I know that you had a question.
As the sun peeks over the mountain and just gives us this golden glow, we've got a call on the line right now, all the way from Durban.
Abby. This is Abby.
Hello, Abby.
Good morning, Abby.
Good morning.
Thank you very much for your call, Abby. What is your question?
My question is that what can I do after I'm losing my hairline?
So what can you do after losing your hairline? Which kind of ties into the question that we were talking about now.
Can different hairstyles cause hair loss? And I think that's maybe what Abby has experienced. Once that hairline is gone, and Abby, I think you've also seen pictures of both Serena Williams, Naomi Campbell. They've all also lost their hairlines as well as a contributor to that. What can one do to get it back?
Yeah, I think you'd like to speak about traction.
I can. So traction's an interesting one because it starts off being reversible, but after years and years of kind of pulling on those hair follicles, it can become scarring. So you really want to catch it early.
Yeah.
And so the most important thing is obviously to adjust the hairstyle. So tight braiding, tight ponytails, weaves, gluing wigs onto the frontal hairline. That's always going to strain the hair follicle. So you want to change the hairstyle, go as natural as possible, and then we can look at what we can do, how much is still possible to regrow, and there are options that we can use from sprays and supplements, and we can improve it.
Okay.
All right, so
as
there
long as it
are
can be
options.
improved.
Yes.
Yeah.
Thanks, Abby. I have a quick question regarding hairstyles as well, maybe like with regards to me. Whenever I go to the barber, depending on which barber you go to,
Yes.
some of them like to, when they do the trim, go a little bit deeper into the hairline. Others, I'm like, yo, you need to just let it grow.
Yeah.
Doing that too often, trimming too deeply in, could that lose me my hairline permanently and start that regression of hairline?
Well, you don't really get to the actual root of the hair follicle by getting a shave on but certainly what is important are infective conditions that can occur, more related to the procedures and the hygiene in the salon, especially with shaving heads, and how that infective process can also then affect inflammation of the hair follicle and lead then to, hair loss later.
Well, it's a big topic. I certainly do hope that we get to chat about it some more. Thank you so much to our experts in the field, Dr. Vanessa Lapiner, a dermatologist as well, then our resident medical professional, Dr. Darren Green, chatting all things hair loss. Thank you so much.
Thanks
This
for
has
having
been
me.
very helpful. I've
Good
been
house
in-
call, I say.
It's my feel-good breakfast show.
Alrighty then, we're back outside on a very beautiful day. Yes, thank you for joining us. Medical Tuesday discussion time. Hair loss is the topic of the day, and we've got trusted dermatologist Dr. Vanessa Lapiner and, of course, our resident medical professional, Dr. Darren Green, on the hot seat answering your questions. If you'd like to ask them, 021-430-9881. Shall we continue?
Yes, can I talk to you about excessive hair shedding? In the break we were talking, and you were talking about when you were pregnant and experiencing hair loss through that. But when can you expect hair shedding to start and stop?
Okay, so if you've had an acute event, so Darren talked about a couple of them. So pregnancy being one, you've got to love what having a baby can do to your body. What happens is that you have a baby, and while you're pregnant, your hair is amazing. It looks glossy. You feel amazing. And then 3 months after you've had a baby, all the hair that's been in the growth phase, the hair cycles through phases. It grows, it rests, it falls out. And suddenly there's a signal to all the hair follicles to go from that growth phase into the falling out phase. And you experience this massive shedding, and it can kind of peak after 4 months, so it can go on for quite a while, and then it will slowly start to slow down and stop. But in a small percentage of cases, it can keep on going into something called chronic telogen effluvium, and that's where you need to look for underlying causes like the iron deficiency or thyroid dysfunction.
Yeah. Speaking of those underlying causes, if we maybe just take it a step back. Before we do that, in fact, let's just quickly take a call. Cassie's calling us from KZN. Good morning, Cassie.
Hi guys. Good morning, Katleko. So nice to hear your voice.
All the better for hearing your voice on this Tuesday morning. What's your question, Cassie?
Okay, I have a scarring alopecia.
Scarring alopecia.
Yes. And well, I've been from 2009. I've been to many treatments and things. But now I just started last week. I'm having like injections on my scalp. So I just wanted to know from the doctor if well, I'm hoping that that would have really helped me, because emotionally it's killing me, the hair loss.
All right. So just quickly say to me again the last. So you've been undergoing treatment since 2009.
Yes.
And you're getting injections to your scalp to treat.
The injections just started now, last week.
And so, what is the question with regards to that?
I just want to know, doctor, that if it's going to help or.
All right.
I'm so desperate at the moment.
All right. So the treatment of scarring alopecia that Cassie says she's been suffering.
Okay, so I missed a lot of that, but I heard scarring alopecia and she's having injections.
Yes.
So usually if you're receiving injections, that's intralesional corticosteroids, and it's dampening down inflammatory response, because a lot of them are, they can be immune mediated. It depends on your subtype. Whatever kind of scarring alopecia you have, there's so many different types of treatments, and you've actually got a biopsy to distinguish which type you're dealing with. So, yes, as I was saying earlier, with scarring alopecia, the emphasis is not on regrowing that hair, it's stopping the activity. So the end point is not going to be that, unfortunately, you can get all your hair back, but if you've got redness on the scalp or little pimples on the scalp, it's that you're stopping that process. But there are also oral medications that you can try, and a lot of them, if the actual intralesional corticosteroids aren't working. But each case is, unfortunately, case dependent.
Are there then alternatives to allow for hair growth in a different way, or at least achieving that aesthetic after the treatment has sufficed in stopping the
So
loss?
once it's burnt out and it's in remission, you can look at things like hair transplantation, just to improve the appearance and get your confidence back.
Yeah, all right.
Definitely.
Cassie, thank you so much for that call. We really appreciate it. We're going to keep our lines open.
Absolutely, and we'll be right back after the break as we talk about hair loss. If you do have a call for us, please do give us a call, 021 4309 881. We'll see you right back after this.